In our rapidly evolving world, success is defined by turning challenges into opportunities. With enough foresight and ingenuity, the complex problems of today can become the achievements of tomorrow. I'm Fred Thompson. From business and technology to healthcare and the environment, join me as we take a closer look inside the workings of the modern global economy. Welcome to Inside Business. I'm Fred Thompson, and I'm Inside Business. There's no more fundamental human desire than the wish to lead a healthy existence. It's an ideal that drives millions of healthcare professionals throughout America today, from the most prestigious research institutions and universities to the neighborhood clinic. This is a story about the people working to keep a nation healthy.
Our kidneys are the internal organs responsible for filtering approximately 500 liters of fluid every day to remove chemical and mineral impurities from our bodies. But for a number of American adults, these vital organs are on the verge of failing or may have stopped functioning altogether.
It's estimated that 26 million Americans have chronic kidney disease. Things like diabetes and high blood pressure can damage the kidneys, leading to decreased kidney function. Early detection and treatment can certainly help prevent kidney disease from getting worse.
When kidney disease progresses, however, it may eventually lead to end-stage renal disease, or ESRD. According to the National Kidney Foundation, more than 350,000 U.S. residents with ESRD are receiving dialysis treatment. With the frequency of dialysis treatments, clinical issues can arise.
In the past, when an otherwise healthy dialysis patient's access would clot, the patient would be admitted to the hospital where they would receive dialysis through a temporary access while they waited for a surgical revision that could take up to a week.
Recognizing that this scenario is not only stressful and inconvenient for the patient, but also a significant cost to the healthcare system, Ray Figueroa knew there had to be a better way. He teamed up with some of the nation's leading interventional radiologists, interventional nephrologists, and vascular surgeons to start American Access Care.
Using the latest minimally invasive techniques, we're able to repair a patient's access in an outpatient setting and have them back to their dialysis center within several hours. This has been shown to prolong the life of the access at a cost significantly less than inpatient care.
American Access Care began its operations 9 years ago and treated its first patient in 2001 in Suffolk County, New York. Today, the company has 27 locations in 12 states along the East Coast, Illinois, and Southern California. Dr. Greg Miller is one of the company's first physicians.
As one of the original founders of American Access Care, I could tell you that I came from a teaching hospital, and what happened was patients were staying in the hospital for many days in order to get their accesses repaired. So when I came to American Access Care, we started performing percutaneous or through the skin procedures through 2 small puncture sites, no bigger than an IV, and we're able to repair the access in a very timely fashion. And about 1 hour after the procedure, the patient's able to go home and then can subsequently have hemodialysis treatments.
On average, the company's physicians have performed between 5,000 and 10,000 access procedures. Nephrologist Dr. Eugene Petra refers a majority of his dialysis patients to American Access Care outpatient centers.
We refer our patients to interventionalists for their vascular access care to help avoid needless hospitalizations. We refer to American Access clinics in particular because we consistently get excellent clinical outcomes. They're accommodating to our patients' schedules to get them back on dialysis in a timely fashion, and universally the patients return with a very positive experience.
Over the past 9 years, we've performed over 150,000 procedures at an estimated cost savings of over $1 billion to Medicare and the healthcare system. We're setting the trends for some of the major changes in the field and plan to continue this in order to improve quality and efficiency of patient care while reducing costs to the healthcare system.